Well, let's get back to the situation in Manitoba, again, Canada's newest hotspot. And to talk about this, we are reaching out right now to Dr. Eric Jacobsohn in Winnipeg. He is an intensive care physician. Dr. Jacobsohn, thank you for being with us today.
Good morning.
So, as you know, Manitoba now the country's hotspot when it comes to per capita case rates. I'm wondering how this is being reflected right now and what you are seeing on the ground in hospitals.
I think it's pretty much what you would expect, that at 500 odd cases a day that are coming through the province, that would be equivalent to 5,000 plus cases in Ontario, to give perspective to that. We're about 1.3% of those cases 10 days later end up in the ICU. So we're seeing roughly 7 to 10 patients a day requiring critical care. And we've gone from a baseline critical care capacity of about 70 beds normally for the province prior to the pandemic to north of 120 beds. And most of those beds are occupied right now, and majority are with patients who have COVID, unfortunately.
So a jump in demand on hospitals right now. I'm wondering if there is a patient profile of the kind of people that are presenting with COVID-19 right now.
So as we've heard across the country, what has obviously happened is as the elderly have hunkered down and been vaccinated, the new variants are obviously affecting a demographic that's younger. Unfortunately, a socioeconomic group that has to go to work, that's often in congregated living arrangements. And so we're seeing a leftward shift in the age profile, and a lot of younger patients that are ending up in the ICU are critically ill.
So younger, as well as you point out, those that don't really have much choice but to still work in this moment, or at least not work from home. So how does that guide, do you think, the types of things that you should be seeing or would like to see from the government when it comes to regulations to respond to the current crisis?
Well, I think the government has stepped up its act in recent days. I think we were living under an illusion when Ontario in the east and Saskatchewan in the west were in trouble several weeks ago that we were going to escape a third wave. It's hit us very, very hard, and it's taxed the healthcare system. And all the public health directives that have taken place will obviously take some time. And hopefully the public are going to comply. And on top of that, the public will hopefully take up the vaccine rollout that's clearly more available to many people at this stage.
You say hopefully, and is that because you believe that right now perhaps Manitobans haven't stepped up as much as they could?
No, I think the vast majority of Manitobans that have been had an opportunity to get a shot have taken up the opportunity. I think it's been well documented that many people that could get vaccinated haven't got vaccinated because of the difficulties of leaving a job. An hourly wage earner can't afford to step away. So there are those circumstances, and there is in Manitoba, like the rest of the world, a part of the population that's vaccine hesitant, and we have a lot of work to do to make certain that we can minimize that section of the population, and through education.
I'm also wondering about your fellow healthcare workers, the people that you know interact with. How are they holding up in this third wave? And given what you alluded to, the fact that what we see in hospitals and ICUs are essentially delayed reactions to policies introduced in a moment in time, how much longer can they keep up this pace?
Yeah, I think it's important to realize that what we're seeing in the hospital may be delayed policies, but also probably some disregard of public policies that were in place. And there is a suggestion that the public policies that are in place right now are not being strictly followed. And that's possibly part of the slow decline in the numbers that we are seeing in the population. And I think we know that healthcare workers, we do what we do because we're in a profession that we serve, and we don't have the luxury of choosing that it's quiet or it's busy. People will step up to the plate and do the work. And that includes doctors, nurses, and other critical members of the healthcare team. But I think what's been missing largely across Canada and this province as well is during the times when you're asking the troops to really, really step up, which is our obligation and it's our privilege to care for these difficult situations and families, you expect transparent and clear communication. And I think that has been lacking. And a lot of the stuff that we see about burnout and anxiety and stress in healthcare workers is partly the stress of dealing with these difficult patients, but I think largely amplified by a loss of control and, frankly, a loss of clear communications from many, many levels of the healthcare leadership team.
Thinking, and very quickly here, that if you give clear communications, it allows Canadians writ large to be able to follow them much more closely.
I think so. You have to communicate clearly, and also for your healthcare teams, you know, they have kids, they have parents, they have to homeschool. It's being able to plan that kind of activity and at the same time step up and do what needs to be done, which has happened across Canada. People have. But the burnout and the psychological trauma on healthcare workers has as many facets. But I think it is remiss if we don't believe a large part of that is not knowing day to day what is happening, where they're going to be, how many patients are going to be in hospital, how many ICUs are going to be open. So I think that's behooving from healthcare workers to communicate, healthcare leaders to communicate clearly during difficult times like this.
Dr. Eric Jacobsohn, thank you for this. Appreciate the time.
Have a good day. Thank you.
You too.